Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on cardiovascular system. Let's get started with question number 1. For the following case, which of the following findings is most consistent with acute graft rejection? A. Concentric coronary atherosclerosis. B. Dense interstitial lymphocytic infiltrate. C. Perivascular infiltrate with abundant eosinophils. D. Patchy necrosis with granulation tissue. E. Scant inflammatory cells and interstitial fibrosis. The case scenario is: a 15-year-old male suffers severe cardiomyopathy following an infective myocarditis from Coxsackievirus and is placed on the cardiac transplant list. 2 weeks following his cardiac transplantation from a matched donor, he is suffering dyspnea on exertion. Extensive evaluation is undertaken in this patient, including cardiac catheterization and endomyocardial biopsy. The question is: which of the following findings is most consistent with acute graft rejection? Your options are: A. Concentric coronary atherosclerosis. B. Dense interstitial lymphocytic infiltrate. C. Perivascular infiltrate with abundant eosinophils. D. Patchy necrosis with granulation tissue. E. Scant inflammatory cells and interstitial fibrosis. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is dense interstitial lymphocytic infiltrate. This question is designed with the focus to assess your ability to apply foundational science concepts. The patient described in the question stem is experiencing acute rejection of his cardiac transplant. Acute rejection occurs in approximately 2 of every 5 hearts transplanted and in the large majority of cases occurs by the cell-mediated pathway. In rare cases, cardiac rejection is due to antidonor host antibodies, and cases of humoral rejection are diagnosed by direct immunofluorescence. The clue that indicates that this patient is experiencing acute rejection is the time frame of symptoms 2 weeks post-transplant, because acute rejection usually occurs 1 to 4 weeks following transplant. The histopathology most consistent with acute rejection on endomyocardial biopsy is a dense infiltrate of mononuclear cells, usually composed primarily of T lymphocytes. Acute cellular rejection of a transplanted organ is mediated by host T lymphocyte sensitization against graft, or foreign, MHC antigens. Acute rejection is usually diagnosed before symptoms set in because of close surveillance of these patients, but symptoms consistent with progressive rejection include those found in heart failure resulting from systolic dysfunction such as dyspnea on exertion or paroxysmal nocturnal dyspnea. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. A. Concentric coronary atherosclerosis. Concentric coronary atherosclerosis found on angiography does not indicate rejection. In transplanted patients, finding atherosclerosis on angiography indicates that the donor heart had pre-existing atherosclerosis prior to the organ being harvested. Acute cessation of blood flow through an organ. C. Perivascular infiltrate with abundant eosinophils. Perivascular infiltrate with abundant eosinophils is a histopathologic presentation consistent with hypersensitivity myocarditis. A large percentage of cases of hypersensitivity myocarditis are believed to occur due to initiation of a new drug therapy, against which the body mounts an atopic response. D. Patchy necrosis with granulation tissue. Patchy necrosis with granulation tissue is indicative of ischemic damage to the donor heart. Ischemia in a donor heart can occur in a variety of situations, including ischemia during attempted resuscitation of the donor patient, during transport of the organ from the donor to the recipient, and acutely during initial perfusion of the organ after transplantation. Ischemia can also occur simply due to atherosclerosis in the donor heart causing classic myocardial ischemia. E. Scant inflammatory cells and interstitial fibrosis. Scant inflammatory cells and interstitial fibrosis is most characteristic of chronic rejection. Chronic rejection is a process mediated by host T lymphocytes and B lymphocytes as well as antibodies, and classically occurs months to years following solid organ transplantation. Your take-home message from this question is that acute cardiac transplant rejection occurs weeks following transplantation and is primarily a cell-mediated process. On histopathologic analysis of an endomyocardial biopsy, a dense mononuclear lymphocytic infiltrate with cardiac myocyte damage will be visualized. Treatment with immunosuppressive drugs is aimed primarily at preventing this form of rejection. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.